I'm so glad that you all are joining in and rushing in at the same time.
You have to scoot this way.
Good
I,
morning, Dr. Peter Pompei.
Morning.
It
Good to see you
is.
here.
It's so nice to see blue skies.
okay.
Very
So,
fast.
Make
Terry, are you feeling better or are you able
it
to
in there. So don't
help
pull
us?
it.
Okay.
Yeah,
Extend.
I'm just stuffy.
11:01. So,
Is
shall
Dr.
we?
Pompei on? I can't see anybody.
Yes, I'm here.
Hi,
He's here.
Dr. Pompei.
Hi, how are you?
Good. Hanging in there.
So, we have 27 people in this space, and I'm sure that more people on the way. Yeah, here it is. Two more people in. And Terry, just let me know whenever you feel that we are ready to go.
Uh, I think yes, we should begin because
Yeah.
we want to be
Good
on time.
morning, everyone. As usual, we welcome you all in here, and then we begin our time with a word of prayer, and then I'm going to turn to Terry for introducing our wonderful speaker, Dr. Pompei. Let us pray together. Gracious God, we thank you for this time together and for the gift of community, and thank you for the wisdom and experience each person brings. So bless Dr. Pompei as he shares with us today and help us receive his insights with openness and encouragement. May this be a time of learning, connection, and gentle hope for all of us, and be present with us now. Amen.
Amen.
Hey, good morning. So before I turn to Terry for the speaker's introduction, just a little bit, few brief housekeeping notes. As usual, to help minimize background noise, I will be muting everyone during the conversation, during the presentation time. And when it's time for questions for sharing, then please feel free to unmute yourself and join the conversation. And with the Dr. Pompei's permission, today's session will be recorded. And once the video is available, then we'll send out a reminder email with the link. So you can check. Also, you can check our Gen2gen website sometime next week or following week to access the recording as well. So thanks so much for being here. We're so glad you have joined us and hope that you will enjoy this time of learning and fellowship together. Okay, I want to turn to Terry.
Good morning, everybody. Welcome. And I wanted to let you know before I introduce our renowned guest speaker today that our format for this program is going to be different. Normally, I introduce the speaker and he or she speaks. But what we're going to do with this after I introduce Dr. Pompei,
Oh, I'm sorry, Terry. I accidentally mute you too. Please unmute yourself and speak, please.
Okay. So our format for this program is going to be a little different. I'm going to be interviewing Dr. Pompei, and then he will answer the various questions, and then we'll open it up to the audience for questions and or comments, and then I'll go back to the next question. So it's going to be back and forth and interactive. So I hope that works for everybody. But right now, I have the honor of introducing our renowned guest today, Dr. Peter Pompei, who's going to talk to us about health concerns as we age. Dr. Pompei is an internist and a geriatrician. He went to medical school at the University of Chicago, and then he went to University of North Carolina to complete his residency.
Shut down your whole thing.
Dr. Pompei then pursued a research fellowship at Cornell University, where you focus on measures of comorbidity and predictions of mortality. He then returned to the University of Chicago, where he served as fellowship director of geriatrics and studied delirium in hospital patients. In 1993, he joined the faculty at Stanford. And while at Stanford, he served as director of many, many programs. He received numerous awards, acclamations, all kinds of wonderful honors. And if I named all of them, our hour would be up instantly. He's just exceptional in every possible way and has been recognized for that. He has been active in the work of the American Geriatric Society's efforts to infuse geriatric principles into the surgical disciplines. Dr. Pompei is also part of, it's called American Field Service, which is an exchange program internationally with high school students. And it's just an amazing, good program. It's been around for many, many years. And he is a very proud grandfather of 4 adorable grandchildren. So I would like to turn the program over to the renowned Dr. Peter Pompei, who will give us some opening remarks, and then he'll throw the program back to me. Dr. Pompei, thank you and welcome.
Thank you, Terry. I appreciate that broad introduction, and welcome to all of you who are joining us today. Glad that you're all here. In terms of, Terry asked me to make a few comments about any changes that we're facing with Medicare these days. And there aren't that many from one year to the next, except, as you can imagine, the fees go up. So each of us will be expected to pay a little bit more into the Medicare budget, those of us who have Medicare, to have the services that they provide. The other thing that I thought might be useful to talk briefly about, and hopefully if there are any questions or concerns about this, I'd be happy to address those as well. But Medicare is now engaged in a program to lower drug prices. And there are several new drugs that are on the list for this coming year, most of which are either anticoagulants, which can be very expensive in people who require long-term anticoagulation, and diabetes medications, again, many of which can be quite expensive in managing a very common chronic condition, diabetes mellitus. So those are plans that are on the horizon. I'm not sure if anybody's seen any reduction in prices yet, but hopefully they'll be coming at some point. And then lastly, I just wanted to make mention of the annual wellness visit, which is not new and it hasn't really changed, but I want to be sure that everyone's familiar with that. So as a Medicare benefit, each of us have the option of having yearly a wellness visit, which allows you to spend time discussing your current medications, the current medical problems that you're dealing with. And also there's an expectation that every physician during these wellness visits does an assessment of your cognitive status and has some discussion with you about any advanced directives or advanced care planning that you would like to discuss. It's sometimes frustrating for some people, or there may be a misunderstanding. This visit does not include an examination. So don't be surprised if you sign up for a wellness visit and you end up not being examined, because that would be typical for an annual wellness visit. They also, somehow my Zoom disappeared. Somehow they also, there we go. They also, so there's not a visit, and they also discourage you from bringing up new problems. So if you just experienced some back pain or some other problem that wasn't part of your chronic medical condition, the annual wellness visit may not be the time to discuss that. It's confusing. I don't know why they did it this way, but those are the rules for Medicare's annual wellness visit. So I think I'll pause here, see if anybody has any questions, concerns, rebuttals, and then we can proceed with Terry's questioning. Yes, John. You're muted, though.
John, when you speak, please unmute yourself and speak.
Peter, where did you get all that hair? I see this picture of a Pompei. I see this picture of a Pompei in the group there, and he's got all kinds of hair.
I know. The more famous ones do have hair.
Oh,
Irrelevant question.
Thanks for letting me join.
Yay.
all right, Dr. Pompei Jr., we're glad to have you.
Thank you.
Question.
Yes, Jane.
Yes, I have a question. My internist sees us 4 times a year. She sees us every 3 months. So during that time, I think the wellness is covered, but I don't know. Maybe I should make a separate time to talk to her at that time.
Well, if you feel that that's being adequately covered, then there's no need for that. It's just an
Okay.
option for those who feel that it may not be adequately covered in a routine office visit, and gives them an opportunity to really explore important issues like a review of your whole medical history, an assessment of your cognitive status, and review of any advanced medical directives that you have.
Okay, no, I think that would be good. I wanted to ask too, is the allotted time, because I know I'm with her just basically a half hour. Is that that's pretty much what when we see our internist just for a checkup, that's basically the allotted time?
Yeah, that's a great question. And it actually doesn't, Medicare doesn't dictate how long you have to spend with your physician. It's usually the practice that makes those kinds of decisions. Sometimes the practices limit routine visits to 15 minutes. Sometimes they're half an hour, and some places they're 40 minutes to an hour even. So it really depends on what the practice that you're attending or a part of allows.
Okay, thank you.
Sure.
Is this time for questions?
It can be, sure.
Can I just say one thing in response to Jane? When you go to visit your doctor, it's I don't know if it is for anybody else, but for me, I get nervous and then I leave and I think, oh, I wanted to ask that. I keep a little tablet, and if I have a question, I write it down so that when I go see the doctor, I have those questions in front of me, and that helps too.
Thanks, Don. That's a very good suggestion and definitely worthwhile.
I know that these days nothing is secret, it appears, but on the principles of, for example, legal and medical privacy, when one signs up for a wellness exam, as opposed to the more familiar ongoing relationship with their internist who can refer to specialists and so forth, whether it's PANF or Kaiser and so forth, is that information that is shared with the in-home visitor placed into one's medical records?
Yes, the wellness visit information becomes part of the medical record, yes.
Thank you. Including what is the consequence of the in-home wellness person who may never have met determining that you have a cognitive deficiency? And is that pipelined into authorities or anything like that? Driver's licenses?
No, it's retained in the medical record. So usually what this involves is a brief screening tool to assess cognition. And that takes many forms. And again, it depends on the practice. A common one would be the MOCA, which is the Montreal Cognitive Assessment Tool, which is a little bit more elaborate than many people do. And some people do a short version. of a screening test where they will ask you to repeat 3 objects. They'll give you 3 things to repeat and then to remember them. And then they distract you by asking you to draw a clock which indicates a certain time. And then they ask you again if you remember those 3 items that they asked you before. So that's called the mini cog. And that's another way of assessing. It's a screening test, though, and it doesn't come with any diagnostic certainty of any kind. So the results are recorded, but they shouldn't be drawing conclusions from it.
The point was well made, I thought, and I'll be done with this, that we often may forget under pressure of time and circumstance to mention certain issues. Are these records routinely, in an ideal sense, reviewed by your internal medicine person so they can see that certain issues might have cropped up that you might forget to mention at your annual physical exam?
Absolutely, they should be. Whether they are is a matter of individual practices, but they definitely should be. And they should, I mean, fortunately with the electronic medical record, with which there are many problems, at least there's an opportunity to record that kind of information in a way that makes it easy to retrieve.
Thank you very much.
Thank you, Les. Yes, Skip.
One way that might help with the visits is to employ a patient advocate who would come in and take notes along with the conversation, make lists of all the things that need to be done, and then that way you're going to have somebody that can help you when it's time to remember all the things that you need to do, the different medications and so forth. So
yeah, that's an excellent recommendation and something that I think physicians should look forward to. They're sometimes a little bit annoyed when somebody else is answering questions for the patient, but they should be able to recognize that this person is there to help support and to make sure that the necessary issues are covered. So thank you, Skip. That's a very important point. All right, any other questions? I don't see any hand. There's one from Sandy.
Commenting on Skip's thing, I know when my dad was in need of geriatric services, I was his advocate and went with him to his doctor's meetings so that we would be able to keep track of things. Now, with the use of AI during my appointments with my doctor, I get such a good report back on all the things that I'm supposed to be doing afterwards that, the after report it's good to go into your system, whatever it is, and take a look at that, because that's going to be all the follow-up things